Our team, welcome back to Plastic Surgery Untold, greatest podcast in the world, as voted by us. We have a special topic today, something that's near and dear to my heart called the structural sandwich, something we developed here at Austin Plastic Surgeons, something that I've personally done on myself, and some of our providers who've done the treatments on me are actually here to help walk us through. So super excited to have a couple special guests. We got our usual suspects with PA Gilbert and Dr. Arredondo, but we also have Monica, our fabulous esthetician down in the SA, and then of course the lovely Jenna, who has taken the injectable world by storm. So we're gonna jump right into it. Let's talk about weight loss revolution and then how we can prevent the Ozempic face and how we can actually treat it, because this is something that's super exciting. You know, the vast majority of patients on some of these weight loss medications, and we'll get into those on another podcast stuff, but lose that 10 to 30 pound stuff. So, and they tend to be relatively young. So you're not a necessary face or neck lift candidate quite yet. Sorry, Dr. Weinfeld, but different episode for that. But what can we do to get it? Because you've worked so hard to live that fit and fabulous life, but you want to look as good as you feel. So I don't know, Jen, do you mind walk us through what is this structural sandwich that we've talked about in our office, in our practice?
Yeah, so I think the key is, like you said, it starts with prevention. And so for a lot of our patients who are on the weight loss program, they're coming in, they're losing, for a lot of patients, weight pretty rapidly. So you want to make sure that you're preparing the skin. Preventing is always easier than treating. So I love to talk about sculpture from the start and just letting them know that it takes a period of 6 to 12 weeks to build. So we're going to inject that, prepare the skin, build that collagen support back into the skin and facial tissues. You can use it all over the body, actually, just not just in the face. But that way, as you're losing weight, you're building that collagen and stimulating that collagen production back. So that way that skin's tightening up, staying in a really nice youthful position. And as you lose weight, you're continuing to look flawless from, head to toe.
And so that's the bottom half of the structural sandwich. And if you think about it, right, your skin is the peanut butter and jelly in the middle. And then each of these sandwiches, you got the bread on the bottom, which is the collagen underneath, stimulating the collagen. And then you're trying to do it from the surface, which, Monica, we tend to mix with what we call RF microneedling. Tell us a little bit about that. And I've done my treatments simultaneously. So I've done the RF microneedling and then come back and done the Sculptra at the exact same time. We do something called Skinny Sculptra, which is developed specifically for this. And then we got expert Gilbert, who's traveled the world training in sculpture. So we'll dive deeper into both of them in a little bit, but just want to give you a little framework. See what I did there of the structural sandwich. So go ahead, Monica.
No, absolutely. So I'm the bread of the sandwich, of course. So we have RF microneedling Vivace. So Vivace is really great. It's going to be your surface base that is going to rebuild the collagen. It's going to stimulate it. We treat the face, the neck. We can also treat laxity on the arms, weight loss. Once you get there, you do start to sag. That's just a natural thing that's going to happen to us as people. So what we do is clients that I already have that are starting the shot, I love to get them on it before, they're even getting to their weight loss goal. But I also love to have the clients that are already at their weight loss goal and they're starting to notice it. We definitely want to target the face, the neck, the décolleté area, and then we move on to other parts of the body, just as Jenna said. And it's great to integrate with the sculpture treatments. So yeah.
I've loved the whole idea that you guys have talked about in terms of prevention, because both of you mentioned that it takes several treatments and that it takes a significant amount of time to really get those results. So if you wait till you're not into the spot where you want and then you start these treatments, it's going to be another several months till you really start seeing those results. And that's why I think holding the line and fighting the fight early is super helpful. People ask me, have I been super happy with my journey? Absolutely ecstatic. Best thing I've done for myself personally in the last 10, 15 years. But the flip side of that is, if I could change anything, I would have started these treatments the moment that I started doing some of these things. And maybe if not day one, at least as soon as I saw that I was down 12, 13 pounds the first month, I would have started doing some of these, because now I've been fighting the fight. And honestly, you guys have gotten me in a really, really, really good spot. But let's jump into it. Gilbert, talk to us a little bit about Skinny Sculptra and how that works and why it's different than some of the other fillers that we use currently. And they're all good for different purposes, but what's been unique about this and why we've chosen this as part of our structural sandwich?
Well, I think Jenna kind of hit the nail on the head when she was talking about how, we utilize this product as a way to help stimulate the body's own collagen. It's considered a biostimulatory filler, unlike the other fillers that we might be familiar with, which are the hyaluronic acid fillers. And those are usually used for volumization and, they can be used for some, repositioning and support of the tissue as we start to age. But But really and truly, Sculptra is, the product that's going to help get that skin nice and tight and back to where it used to be before patients had these massive weight loss changes.
Yeah, we talk about these. I think one thing that we're kind of hinting at but not saying exactly is Sculptra kind of goes in a different place than our traditional HA fillers. Like, it's not going right on the bone or just under the skin. It's a little bit different. One of you guys want to talk a little bit about that and how you're kind of a little bit different layer?
Go ahead, Jenna.
Yeah, so I love to tell patients it goes in the deep dermal plane of the skin, which is right where the collagen lives. And so that's what I tell them all the times. Patients like, oh, I take collagen supplements or I do collagen creams, but that's not actually getting into that exact plane where the collagen, produces itself or is living. So that's what's super neat about it. You do have some swelling and things like that afterwards because obviously we're injecting it into that layer of the skin. But yeah, so it's not like we're doing it on bone or things like that. You're going right into that area.
And there's different areas that you can put Sculptra depending on what you're using. This is what is super cool. And this is what's going to a very experienced provider can help because you can do all these products in different spots depending on what effect you're going for. And I thought Gilbert made a really great point in terms of, other fillers is something that's used for just volumization. And you can use Sculptra for that in the different amounts. And that's why we developed Skinny Sculptra because we're more focused on collagen stimulation and adding that structural support to this. And this is what's super cool is that, I'm going to speak for me personally here, but, after losing 80 pounds, the last thing I want to do is refill my face. When I look at old pictures, I'm like, damn, but what I do want to add is some nice, chiseled jaw. Thank you, Nurse Sarah, and then a little bit of structure stuff here. So I love the point you made that we're using this in a completely different way to stimulate that collagen, add that structure, but not trying to necessarily add volume. And that's why we combine this. That's why, like Nurse Jenna's saying here, there's some different planes. You can be right under the dermis in that soft tissue. Definitely there's some uses for Sculptra around the bone when you're trying to do some jawline filler, other stuff. But again, why you want to go to an experienced injector that really knows all these subtleties? Because if you're just doing cookie cutter, everybody's going to get the same thing. Not everybody needs the same thing.
Right. Not everybody responds the same way, and you have to know the differences. We've really developed this over the last several months because we've seen hundreds, thousands of patients come in and lose just pound after pound after pound. We've seen these changes. We don't just take body photos. We take face photos now because we've seen the face, the neck change, and these are all things help designed to prevent those things from happening. As we know with anything in medicine, prevention is way better than trying to treat after the fact.
Talk to us a little bit about the RF microneedling and what that really is and what it does, because it's super interesting because it can help with the texture. It can also help tighten the skin and a big leap up from the old skin pen, which there's still a place for, but some really unique stuff. And then lastly, not to put you on the spot to answer 1,000 questions, but we are, is what has made Vivace so unique? And maybe Gilbert, who I know is going, and by the time this airs, maybe have already been there, but is actually going to Vegas to speak on this. So maybe the two of you can talk a little bit about those uniqueness of that.
So, me? You?
Ladies first.
Yes, absolutely. So what the radio frequency does, so yes, there is skin pen. We know it's been around forever. It's still amazing. We love using it for scar revisions, other things as well, right? But what the Vivace does, it has that radio frequency agent in there. So it is heat stimulated. So it helps to develop and rebuild that collagen. So Vivace is something great when you want to start to regain that youthful look once again, because we do start to lose it, right? And we all, this whole circle, we keep saying preventative. The reason why we're saying this is because when we do start treating you before that, 5-10 pounds that you've lost, where you start to really see that sag, we've already prevented that. So you're not really going to see too much of that elasticity. So you're already going to be ahead of the game, per se, versus somebody who's like, oh, I've been on this shot, I've done great. And people are loving it. Like, people, I will tell you, in San Antonio, they are loving it. It's amazing. And they're losing, they're getting at their goal weights, but now they're starting to see all that elasticity. So you do want to have those Vivace treatments. You do want to get a package of them because we treat you once every 4 weeks, and we're just stimulating and rebuilding that collagen because it's going down 3 layers into the dermis. What makes it different than anything else, which there are other microneedling devices out there, Vivace has insulated tips, which makes it a lot more comfortable to have done. And it's just a beautiful procedure. And I'm going to go ahead and pass it over here to Gilbert.
Well, so Gilbert, I was going to wonder if you could answer what other changes can you expect to see in the skin? Because we talked about helping that elasticity, but what about other things that are also being treated sort of along the way?
So one thing that I always counsel my patients about is when they're having this massive weight loss, they can lose, as we've been talking about, this elasticity and gain a lot of skin laxity, right? But there can be some volume loss. There can even be a little bit of loss of not muscle volume or strength, but it just kind of thins out a little bit because we don't oftentimes have these patients, or we can't. Well, let me rephrase what I was going to say. We can't assume that they're doing the workouts that we ask them to do, right? And so a lot of times they're relying simply on the medication alone to help them lose their weight. And so they forget that they need to incorporate a healthy lifestyle, such as eating a good, healthy, balanced diet and exercising regularly, so they can maintain this muscle volume. They can maintain, their physique and their body composition.
What's unique and if you can go a little bit further into Vivace itself, because anybody that's seen me, I mean, with my Botox, I'm the world's biggest baby. I actually tolerated Vivace extremely well, and some of you who follow our story and those that don't, shame on you. We did the entire treatment before our morning huddle at 6:45 in the morning, and so pretty amazing how quickly you can do all of this. And I know Monica alluded to it a little bit, but a couple of the cool things about Vivace that makes it probably one of the most comfortable. There's a lot of great RF microneedlings. We have Vivace and Morpheus A, but Vivace has a couple of unique items.
And so I've used both. Since I travel back and forth to both offices, I'm experienced in both of these devices. I will say that with the Vivace, it's my personal favorite. I have a little bit better control over the handpiece. I feel like it's a little bit sturdier. Obviously, that doesn't make a difference in outcomes, right? But just overall, I think it's just a really great device. But to Monica's point, one of the most important factors is these insulated needles. The insulated needles are going to help mitigate some of that discomfort that can come from the radiofrequency energy itself, and it allows it to be a little bit more direct into the area that we want it to in a more controlled way, and that's what allows the procedure itself to be more comfortable for the patient overall.
I want to do some rapid fire before we run out of time here and stuff. So we alluded to a little bit. What's a typical treatment series? Like, how many treatments is somebody going to need over this? And obviously going to vary greatly on their weight loss revolution course. But people who don't have weight loss and just have kind of the normal course of aging can be good candidates for this as well. But what's a typical treatment kind of? And I know it varies, but we'll give us a range here.
I believe so. I would start with me in the first, right? Well, the Vivace to begin with, because we're just targeting that collagen stimulation, right? We're rebuilding it. I love how, and that's going to be for your first 4 weeks. After that, you can go and get some sculpture done. I think sculpture is going to be amazing because she can maneuver it a lot more and, just kind of contour where they need to be. But then we're also going to need our filler, because filler is what's going to provide that thickness. So you're always going to want your RF microneedling to give you that, just that rebuilding of the collagen. You want it to stimulate. I recommend packages. I'll do a package of 3. So then you'll see me, you'll go down, you'll get your sculpture done, then you'll have your filler done for your thickness. So it's a trifecta. You want to have them all together to get back to your desired results as you want and fall back in love with your skin again.
Yeah, I think a couple of those things are super important. One with the structural sandwich, you can do your RF microneedling and your skinny sculpture all in the same day, which is super important and super exciting, because for those of us that are super busy, it's hard to come, too many times, especially when you already know that, like you mentioned, with the RF microneedling and the sculpture and some of these, you're going to need multiple sessions to get you to a good spot, because part of it is the absolute minimal downtime. So you can do this, get in there, but if you're not being overly aggressive with the skin, especially with some of us with darker skin tones, you want to make sure you heal well, make sure you're doing well, but also let that skin contract, come back and do some more. Obviously, if you're continuing your weight loss journey, you're going to get a little bit more skin laxity that we got to keep treating. I think no question, like you said, there's going to be some structural support you want to add with maybe a little bit denser, thicker HA filler, that you can do for jawline, for cheeks, for other stuff. And so I do think it's kind of a spectrum that we can help guide you. And everybody's going to be a little bit different about where you get to.
I think a lot of times with the HA fillers, you're trying to use, like a round peg in a square hole kind of thing. And so now we've really got a lot of tools that we can tailor towards what exactly we're trying to do. Sculpture helps build the collagen from below, helps your body restore some of that elasticity. RF microneedling can do the same, but from the top. It's that top layer of the bread like you're talking about. Not just restore that collagen, but also help thicken the skin, give a more useful appearance. Those patients with acne or with other types of skin issues, pore size can all help with that. And so it really just rolls the clock back years and gives you that younger, fuller skin, that look that you're really looking for. And combined with the other products, it's just fantastic.
Jenna, other thoughts on that?
Well, and I feel like we've talked a lot about the face, but what's so neat about all these treatments is you can use them all over the body. For a lot of patients, they're getting a lot of skin laxity in their buttocks and their thighs and all these different areas, and those are great areas you can treat as well. Microneedling super super great for those treatments, but it's not just isolated to the face. You can use this all over your body, which is neat.
I like what you did there because our next episode is called the Ozempic butt treatment. So I like the plug.
Yeah.
So I see what you did there.
Stay
That was
tuned.
good. G, any last thoughts about the structural sandwich?
I was just gonna say the same thing that Dr. Arredondo said. It's the takeaway point is that the structural sandwich is using a product like Sculptra to stimulate the collagen from the deeper layers, and then using something like RF microneedling to address collagen production and skin thickening from the surface. And so you're addressing it from both depths and really just getting some of that elasticity back, some of that dermal repair.
It's hard to put a name on it, isn't it? But it just rolls the clock back. It's just your skin looks younger. You take years off your life.
And for our patients listening, I mean, correct me if I'm wrong for any of our injector stuff here, but most people, there's really minimal downtime. If you did this over lunch, you could go back to work that evening, definitely the next day. Really, post-procedure, there's not really much discomfort at all. Maybe you can have a little bit of red hue from the microneedling, but other than that, I really didn't experience much. Is that pretty common?
Yeah, no, absolutely. So the way we do it in our office, and in my experience, I always do a calming mask before I even send my clients out, because I do want them to be able to. People are busy. It's time consuming. People want to come in, they want to get out. So I do a calming mask. I make sure that I have them ready to go back for their day. Of course, yes, there's going to be that redness because we just did all those microchannels into your skin. But, absolutely. And again, towards your structural sandwich, I agree. I think it's great. And it's very simple, people. We can never stop you from aging, but we will do everything to slow down your process.
One thing I will say, I snuck in and got some Vivace not long ago, a while ago now actually. It wasn't but not too long ago. But I had a little bit of redness immediately after. The calming mask afterwards just felt like it really helped, like the microneedling, all those channels. I feel like they just make that work even so much better. Those products get deeper into the skin, and then the next day you couldn't even tell I had anything done. And over the next few weeks, I got a lot of compliments. I liked it.
Any last comments about structural sandwich that any of you guys would like to leave our listeners with? G, Monica, Jenna?
I feel like we've hit everything.
Just
Awesome.
that we're super excited about it. It's been
Yeah,
great.
I think this is something that's really cool. Something we've worked hard because the weight loss revolution has been so passionate to us. One, I think if you're in that weight loss revolution, really trying to be preventative and ahead of that. Two, don't forget, just even if you're not part of the weight loss revolution, you already were in a fit and fabulous, and we're trying to catch up to you. Doesn't mean that you still can't do something for that skin, because unfortunately, the natural aging process does cause some dermal thinning. We all lose a little bit of volume in our face, no matter what with age, and you also affect some of the bone structure that maybe we'll talk to at some point as well as we age. So appreciate all of you guys listening to Plastic Surgery Untold. Appreciate our two special guests coming in, Nurse Jenna, Monica from the SA. So stay tuned. A lot more to come. Plastic Surgery Untold, greatest podcast in the world, as voted by us. You can hear us anywhere you get your favorite podcast: Spotify, Pandora, iHeart, iTunes, of course. And if you want to see our pretty faces, or mostly just Monica and Jenna's pretty faces, check us out on YouTube. We'll see you guys soon. Bye.
Bye.
Bye.